Thank you, Mr. Speaker. Our race between the vaccine and the virus continues. As a nation, we've taken some huge strides forward, Mr. Speaker. There are now 908 people in hospital with coronavirus, a fall of 9% in the past week, and the average number of daily deaths is now 6, the lowest number since the middle of March. On top of this positive news, Mr. Speaker, our vaccination programme is accelerating at pace. Over 72% of all adults have now been given their first dose, and 43% of all adults have the protection of 2 doses. And this weekend, we reached the milestone of 60 million vaccines administered across the United Kingdom. Mr. Speaker, this weekend, Public Health England also published new research showing that the effectiveness against symptomatic disease from the variant first discovered in India is similar after 2 doses when compared to the B117 variant dominant in our country. And that, as with other variants, even higher levels of effectiveness are expected against hospitalisation and death. This is encouraging data, Mr. Speaker, and it reinforces once again the importance of our vaccination programme in giving us a path out of this pandemic, as well as showing just how important it is that everyone comes forward for both jabs when the call comes through. Mr. Speaker, it's the progress made by the British people in following the rules and the protection offered to our vaccination programme that means we were able to take step 3 in our roadmap last week. But we take these steps with vigilance and with caution, staying alert to new variants that can jeopardise the advances we've made. We've come down really hard on the variant first identified in India, wherever we have found it, surging in testing capacity and vaccine for those who are eligible. Over the past few days, we've extended this rapid approach to even more areas. So, as well as Bolton and Blackburn and Darwin, which the Prime Minister spoke about at his press conference on the 14th of this month, we are taking rapid action in Bedford, Hounslow, Burnley, Leicester, Kirklees and North Tyneside. As the Prime Minister set out 2 weeks ago, we're urging people in these areas to take extra caution when meeting anyone outside their households or support bubble, including meeting outside rather than inside where possible, keeping 2 metres apart from people you don't live with, and that people should try to avoid travelling in and out of the affected areas unless it is essential. For example, obviously for work, if you can't work from home, or for education. As the Prime Minister said, Mr. Speaker, we want the whole country to move out of these restrictions together, and we're trusting people to be responsible and to act with caution and common sense as they have done throughout this pandemic, and to make decisions about how best to protect themselves and their loved ones, informed by the risks. That is exactly what we should be doing. We're always looking to see how we can communicate more effectively with local authorities, and we will, of course, take on board the views expressed by the House over the course of this debate, Mr. Speaker, through acting quickly whenever the virus flares up and protecting people through our vaccination programme. We can guard the incredible gains we've all made and get ourselves on the road to recovery. Thank you very much indeed.
Secretary of State Jonathan Ashworth.
Thank you, Mr. Speaker. Does the Minister appreciate that cities like mine in Leicester, or towns and boroughs like Burnley or Bolton or Batley and Blackburn borne the brunt of this crisis these last 15 months? We've often been in lockdown longer than elsewhere. At times we felt abandoned. We didn't have adequate financial support. Families did their best, but they struggled. So can the Minister understand how upsetting it is? Can he understand how insulting it is to have new restrictions imposed upon us, local lockdowns by stealth, by the back door, and the Secretary of State doesn't even have the courtesy to come and tell us? Why was this guidance plonked on a website on Friday night and not communicated to everyone? Why were local directors of public health and local authority leaders not consulted? Why weren't MPs informed? And what does it now mean for our constituents? What does it mean for the family in Leicester who have booked a few days next week by the coast for school half-term, Do they have to cancel that break? What does it mean for university students in Leicester when they finish their exams? Do they have to go home? Or can they go home? And can prospective students come and look at the campuses? What does it mean for the parents in Bolton who are planning to take their children to see grandparents on the other side of Greater Manchester this bank holiday Monday? Should they rearrange their plans? What does it mean for the young couple in Burnley or Blackburn or Batley who have postponed their wedding for over a year and have invited friends and family from across the country to come and celebrate their special day with them? Is the message to them that they have to delay their wedding again? Can the Minister answer these questions today? And can he take a message from me, as the Member of Parliament for Leicester South, back to the Secretary of State? Withdraw this guidance now and convene a meeting this afternoon of the relevant directors of public health to produce a plan involving isolation support, enhanced contact tracing, and because he knows from his own work as Vaccines Minister that a single dose of the vaccine is less effective against this particular variant, will he produce a plan with local directors of public health to roll out vaccination to everybody and look at including bringing forward the second dose for a larger cohort of people? Now, Mr Speaker, in closing, a year ago, ministers like him were defending Dominic Cummings on Twitter. Now Mr Cummings tweets about the lack of competent people in charge. Well, many of our constituents, looking at this latest lockdown fiasco, will think that Mr Cummings has a point.
Thank you, Mr Speaker. I thank the honourable member for his, I hope, equally supportive comments when it comes to supporting his constituents and others around the country in Bedford and Blackburn and Bolton and Burnley and Kirklees, Leicester, of course, his own patch, and in Hounslow and North Tyneside. The one thing I would urge, and I spoke to the Metro Mayors this morning, the M10 Metro Mayors, is that we all work together and take the politics out of this. I think our constituents deserve that. Essentially, as I said in my opening statement, what we're asking people to do in those affected areas is to be cautious, is to be careful. So on visiting family that he asked about, meet outside rather than inside where possible. Meeting indoors is still allowed in a group of 6 or 2 households, but meeting outdoors is safer. Meet 2 metres apart from people you don't live with unless you have formed a support bubble. This includes, obviously, friends and family you don't live with. So, yes, people can visit family in half-term if they follow social distancing guidelines. The guidelines include specific sections on meeting friends and family. Avoid travelling in and out of the affected areas, as the Prime Minister said on the 14th, unless it is essential, for example, for work purposes. The whole principle here, Mr Speaker, is that we need to work together. He has a responsibility, as I do, as do the Metro Mayors, to communicate to our residents, our constituents, that this is a time to be vigilant, to be careful. We're putting more surge vaccination and, of course, surge testing and turbocharging vaccination, I should say, in those areas to make sure that we do the work with local directors of public health. And absolutely, I hope he will agree, we've had that plan in place. We've seen it operate in Bolton and Blackburn, and we'll see it operate in his constituency in other parts of the country as well.
Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr Speaker. Can I congratulate the Minister for the outstanding rollout of the vaccine programme, which is a source of enormous pride to all of us on all sides of the House. As we emerge from lockdown, we all want it to be a permanent change, and for most families the biggest priority is to make sure that schools remain open, even if we find that new variants arrive in the UK in the course of the autumn. We know that children don't tend to get bad symptoms, but they can spread the virus. So is it time to look at vaccinating the over 12s, as they are doing in the United States? Is it time to look at whether we can use some of the FDA analysis to speed up that decision-making process so that by the time children come back in the autumn, schools are protected and we can be confident they'll be able to stay open?
I'm grateful for my right friend's question. I think he's absolutely right to focus on the protection of children, but also of families and their community. And that clinical decision has not been taken in the United Kingdom. He will be aware, as well as the US regulator, the Canadian regulator, has approved the Pfizer BioNTech vaccine for 12 to 15-year-olds. We will operationally be ready, but ultimately the decision has to be a clinical one, and our regulator will have to be satisfied that the vaccines are extremely safe, because when you're vaccinating children, where essentially you're, yes, offering some protection to them, and of course children can be infected with COVID and have some evidence of long COVID amongst children, but on the whole, it is really to protect their families and transmission in communities. The vaccines have to be incredibly safe before we administer them to children, but we have the infrastructure in place to be able to do that as and when that regulatory and clinical decision is made.